Okay, this video is what are hospitals really like? And what hospitals are really like from the point of view of the doctor is they're like an assembly line. And this is what the patients go through. The doctor's job every day is to walk up to the assembly line and sit down and start cranking out billing codes. And the little objects going past, the widgets if you will, those are the patients. And for the doctor, there's always a foreman, standing over them saying, hurry up, hurry up, hurry up. Speed is the most important quality valued in a doctor. All right, now it is true that some things are more complicated. It's less complicated to be internal medicine doctor and just, going through a checklist and giving the patient drugs. Don't get me wrong, they sometimes do some pretty complex thinking, but their job basically is to go through a checklist of diagnostic stuff, diagnostic tests perhaps, and then prescribe a drug. In the more surgical areas, there's more complicated things like, putting in a kidney transplant that requires more of a team rather than an individual. So it does get more and more complicated, okay, but it's still an assembly line. And what really drives the assembly line is this. In every Western hospital, there's always a bean counter, and the beans that are being counted are the number of billing codes generated by the doctor every day. And the bean counter has a whip. And it's a very powerful whip. And if the doctor does not generate his beans for the day, he will be whipped. And this is how they also get doctors. The doctor gets hired to work a shift, whatever that shift may be. Let's say it's 8 o'clock to 4 o'clock. But in the real world, that's one of the jokes is why are, nurses, secretaries, and techs jealous of doctors? Because doctors make more money. Then the question is, why are doctors jealous of secretaries, nurses, and techs? Because they go home when their shift is over. Doctors do not go home when their shift is over if there's more work to do. And what hospitals tend to do is keep on piling on more and more work. And then they just say to the doctor, well, look, so-and-so across town, their doctors routinely generate this many billing codes. You just need to be more efficient. So the doctors tend to have more and more work piled on them, and it's not easy for them to get out of that. Okay, then I'll show you what comes next. This is the business meeting. This is a typical business meeting in a Western hospital. There's always some administrators who are beholden to some other owners higher above them. And the job of these administrators is to make money for the person who's so rich and wealthy, they're not even there. And they sit there and they'll say, oh, we need to make sure that we are productive and that we are efficient. And they're all about generating as many billing codes as fast as possible to make money for the person who's not even present, okay? And most of these guys don't know almost anything about actually helping an individual patient. And, the big assumption is, well, everything is based on the standard of care, and the standard of care is sort of just taken for granted that obviously we practice the standard of care. All of our doctors are board certified. We all practice the standard of care. And that sounds good, but in reality, the standard of care means the lowest common denominator that's applicable for demented, intoxicated, unconscious people, lazy, stupid people, drug addicts, alcoholics. And it's also true these types of people are sick all the time. The kind of smart people that are sitting on the internet reading and studying health, they don't get sick very often, most often. Or, part of it is once they do get sick, then they start reading if they're smart. But anyways, the important point I'm making here is that optimal care is irrelevant. And also notice what is always talked about is productivity and efficiency, productivity and efficiency. And that's a surrogate for actually caring about outcomes. They never talk about outcomes, because if they talked about outcomes, let's say somebody talked about outcomes for coronary artery disease. You don't improve long-term longevity outcomes with a stent for an elective case or a CABG, coronary artery bypass graft, open heart surgery for an elective case. The way you increase longevity is if you put them on a low-fat, low-sodium vegan diet, whole foods with no oils. But so they can never go by outcomes, because if they did, the low-fat vegan diet would take over. So they can't do that, and that's why they never do. But what I'm saying is the patient goes to the hospital hoping the doctor will help them to get better, but that is not the doctor's job. The doctor's job is to generate billing codes for the bean counter and for the administrators, because if the doctor does not generate billing codes for the bean counter and the administrator, there will be serious consequences for them. I mean, here's what it comes down to. It's a carrot and the stick, okay? The carrot is, run as many patients through the assembly line as fast as possible, generate as many billing codes as fast as possible, follow the standard of care, which usually means sell drugs or surgeries or imaging tests or blood tests in the lab as fast as possible. And the more you sell, the more carrots you receive, and likely you'll get promoted, you'll make more money, okay? If you go down this path and you start talking to these poor, pathetic patients, you're going to be going home late every night. Your RVUs, relative value units, billing codes generated is probably going to drop. And sooner or later, if you keep this up, staying up late with these patients every day, you're going to be tired, you're going to be exhausted. And if you're not seeing enough patients, generating enough billing codes, the bean counter is going to come after you with the whip, and there's going to be consequences. You're going to lose your job, you're going to get in trouble, you're going to be fired, and if you're really pissing off the system, they'll take your license away. So here's what happens to doctors who don't obey the system. And so basically, they have to conform to it. They don't have a choice. And they can try to do a little more in there, here and there, but it's going to mean usually they go home and they're already overworked and exhausted. So this is why you don't see more doctors going down this route of, learning nutrition, epidemiology, toxicology, and talking to the patients, because there's pretty significant punishments for going down that route.